Hi, I'm Yasmin, a wife and a proud new mom with a background in perinatal nursing. Welcome to Birth Unboxed, where we talk about all things birth, whether it's unassisted free birth, home birth with a midwife, or in a hospital. I believe every woman deserves the right to choose how and where she gives birth. I created this podcast to raise awareness so women can make informed choices and feel empowered in their births. By sharing stories and learning from one another, we can reclaim our power and become the ultimate authority in our own birthing experiences. Sisterhood is powerful, and I am so glad you're here. Let's get started. If you haven't listened to the first part of Mariana's story, please make sure you go back to last week's episode before continuing on with this one.
What I can say about this, although we had positive consequences, is my feeling is that this has impacted not only this birth, but my entire motherhood journey and the future.
Of course.
Wow, what a story. And I feel like it's so heavy and painful and traumatizing in so many ways. But unfortunately, it's such a common story. So many women go through exactly that, and so many women just accept it. That's just how it is. And it's like, no, it shouldn't be
Yeah.
that way. This is bullshit. Yeah.
And the one thing that I wanted to show too, let me see if it's here. So that's one thing, so this was the one of the pictures
Yeah.
when he was born, and the photographer I didn't notice, they only unrestrained like my left arm. So she was very sensitive, and in the pictures she made sure to only focus on that because my right arm was still restrained.
Yeah.
And it was something that, to me, it was like one of the only people along the way that had the sensitivity of capturing the moment without making it more traumatizing.
Yeah.
Although like the
Yeah.
teaser video, like there's no escaping, like, and it was like the first frame, like I don't think they intended that, but like the pictures, she was like very careful to make sure that,
So did you have a photographer, like a birth photographer?
Yes, because at
Yeah.
that time it was like you could only have your partner or support person and then an extra person. And because we had decided not going with the doula, we decided to have a photographer so we could at least have a memory.
Yeah.
Because we had like no baby shower, no like
Yeah, of course.
reveal, nothing.
And a lot of places you're only allowed one person, period.
Yeah.
So that's one bonus thing, which is, like considering everything else, but
yeah. And like I was saying, I think of course the miscarriage had a role in it but I think what the miscarriage gave me in terms of like impact consequences was to be a little bit more, one, to be grateful, of course, like because you see motherhood like in a different light, like, and you learn how to appreciate small things. And when I saw my baby in the NICU and I saw like, okay, but he's fine, he's getting out of this, like it was only 4 days, like you're way more grateful for things, like okay, things are like, I'm taking this baby home and I'm so like lucky to have my son with me regardless of like the journey to get here. But then when somebody decides putting you through a surgery that you don't need and lives you with all of the trauma, that person is also changing the outcome or the possible outcomes for the next experiences. Because now, in a third pregnancy, which is my daughter, she was born two years ago. Not only I had it, like if I wanted like a natural delivery, it would be a trial of labor, and if successful, a VBAC, a vaginal birth after a C-section. But it's not the same as going into a first experience and attempting, or I don't like the word attempting. I also don't like when people say I was able to, because it's not about ability. It's not about competence. It's not about like it's not. It's just not. So that's like wording that I don't use, but for the sake of it, if I do, please excuse me. But it's just not the same because you're going into a second full pregnancy or like a second birth with all of those like preconditions, like you've had a C-section before. So now every appointment, when I got pregnant with my daughter, every appointment you have to answer, how many children, how many live-in children, how many C-sections, and it hurts. Every appointment you have to say that. And then you not always get great professionals that understand why. So every appointment, and being a high-risk pregnancy, you have a lot of those because it's not just the regular appointments. I had appointments every month, and by the end of it, like every week. So I don't know, more than 15 appointments in which I had to answer, why did I get a C-section? Because in Canada, although we have a larger number of vaginal deliveries, they're not necessarily great experiences. And people don't understand the culture in different places. So I got pregnant with my daughter when I was already living in Canada. We were permanent residents. We had the access to like public health care. I was in Ontario. I now live in Montreal, but it doesn't seem to be very different. So when I got pregnant with my daughter, every appointment, the questions were the same. And you have to answer. And not everyone is very like kind when you answer, well, I've had a C-section because I was forced into it. A lot of people, it's crazy, but they will like roll their eyes and say like, yeah, sure, I'm sure the health professional, like the healthcare professional had a reason to put you through a C-section. It's just like, they cannot conceive the idea that I was forced into it. It's like, no.
It's like, they need a reason. They have to write a reason down, you know.
Yeah, and maybe you're not accepting, but that's not possible. Like you were put through a C-section with no reason. What? Sure, like this is you, the patient talking, the healthcare professional, the god, the goddess of your healthcare. He or she had a reason for that.
One of the most common ones I see is failure to progress, which is just like, we did not fail to progress.
Within the timeline that they request. That's the thing. Okay. So her pregnancy was even better because I had access to more care. I had a great endocrinologist, great diabetes nurse, even better than Brazil. Like we would have appointments every 1 week or two. So my levels were even more like controlled. Like my blood sugar and my HbA1c, which is the exam, for those who don't know, that measures your glucose levels usually when you're not pregnant for the last 3 months, but when you're pregnant, it actually refers to the last month because it varies so much throughout pregnancy for diabetes patients. It was better than people that do not have diabetes. So it was really good. So I made sure that everything was perfect. But again, my pregnancy had no complications. My daughter was perfect. She was also a somewhat large baby, 3.5 kilos at 38 weeks. Of course, he was bigger, but it's like bigger, like it's not, you know, it's not a 12-pound baby. Like, so everything was great. But the difference between countries and scenarios is that in Brazil, I feel like obstetrical violence is like more like in your face, like it's easier. And it's just like doctors like act as authorities. And as I mentioned, like everything's so productized, like that if you don't have the access to this privileges or this fake privileges of like you have like a team, like who the heck needs a team to give birth? You're giving birth. You need assistance. If that's one doctor, one midwife, one nurse, a support person, like you need assistance. I hate when doctors also say like, I don't know how to translate that to English, but they say like, I gave birth to like, or I delivered. Is that what I've delivered a bit? Like, no, you didn't deliver anything, my hun. Like no, it didn't come out from you. No. You're not delivering. You're assisting. No. The wording thing. But in Brazil, like, I feel like it's more pronounced. Like it's easier to identify certain violences. And here they come in a very subtle, nice, like caring mode. One of the things that I've experienced from the beginning, the first thing I said, well, I do not want to give birth laying down because again, this was like years after I had my first child. I was already
Mhm.
like studying birth, delivery, like prenatal
Yeah.
topics, like for a long time.
Mhm.
So I said, well, I know that if I feel like laying down to deliver, then that's one thing.
Yeah.
But I don't want this to be the standard, like, and I remember the chief nurse, when I went in for my first appointment, I told the chief nurse that I did not want to deliver while laying down because I knew that this position wasn't very favorable for the pelvic region, for like, it was more prone to tearing and everything, which is things that they're not discussed during an appointment. And it's like no one touches those subjects. But if, it's like, but it's more comfortable for the doctor. Of course it is.
Yeah.
Of course it is. You're laying down. All they have to do is pick up the baby and then say, I delivered it. After,
Yep. Pulling out the baby in that last second. Yeah. After you've done all the pushing.
And she told me, like, imagine, this was her answer. Imagine, like, every shift, it's like 15 babies that we deliver. And I was like, oh, wow. Are you able to deliver 15 babies? Like, you? Wow. I was like, okay. And imagine how I swear to God, this was her words. The doctor's back, how it would be. Like, we would lose doctors every couple of months because their backs would hurt so much. And I was like,
I can't believe that.
That is so not my problem. And I'm a very like unfiltered person when I need to be. So I was like, that is absolutely not my problem. And you're not telling me what I'm doing with my body when I'm delivering my daughter. Like, let's establish that. And she was like shocked. And I just left it alone. And I was like, she's like, and that was the first violence, because she was like, if you're looking into a more natural experience in which you're more like have more freedom, maybe you should look into getting like care from a midwife. And I said, you know very well that if I'm in a high pregnancy risk clinic, that's because I cannot be followed up by a midwife. So what you're telling me is extremely violent and extremely stupid, because you're telling me about a choice that I don't have. And it's not because I want to. I'm not diabetic because I want to, love. I'm diabetic because I am. So anyway, I felt like the first violence was her telling me like what I should do with my body. The second thing was like giving me a choice that I actually did not have, and like kind of like rubbing it in my face. And I'm like, thank you for that. That was very empathetic of you.
Yeah.
Anyway, like then I went into my first appointment with a doctor, and the high risk clinic had 2 doctors, and we couldn't really pick which doctor. It was like rotating. But I got very attached to one of them, and then she let it slip the days that she was on schedule. So I was able to always be followed up by her. Because the first one, she, from the appointment 1, pushed me to say, well, I can support a VBAC, but just some births, they have to be C-sections and they have to be C-sections. And I'm like, yes, I understand that. If there's a medical reason for that, and, you know, there's like certain things. And she's like, okay, we'll not discuss that, but let's talk about epidural. You should get an epidural, like from the moment you're admitted, because it's going to be easier. And the whole story about like, if something happens, maybe you will have to go into under full anesthesia. Your husband won't be there. You will be intubated. You will not be able to see the birth. And I don't know if that was supposed to be encouraging or scaring, scary. And I was like, no, thank you.
Yeah.
And because, again, I keep thinking I'm privileged because I was able to study and I was able to like back up my decisions. But even so, there are people that they're not comfortable with speaking up. I have no problems, but again, I couldn't speak up during my first delivery because I was in no conditions. But for the second, I felt more empowered to say I was ready. So, but that also did not guarantee the outcome. So I wanted a VBAC. I wanted a natural. I did not want to go through any interventions. Let's jump to 37th week. Oh, so I've always did the scans and the baby was within the 50th percentile. So she was like normal size. 36 weeks. And we all know like that technicians play a big role. And sometimes because the hospitals are understaffed, they will take like people that are not as prepared, or they're not as great professionals, or not as experienced. And in a high risk clinic, I think this should not be the case. But after the 36 weeks scans, the baby went from a 50 percentile to like 96, 98. So the doctor immediately, even though I loved her, started being concerned. Like, at first she was like, we'll repeat the scan next week, 37th week. If the baby still shows big, because this could be an error, like a measuring error, then we're going to start discussing options of induction. And I was like, I don't want to be induced. There's no reason for me to be induced, which in Canada, different from Brazil, which they skip right to C-sections, I feel like inductions are like the way that hospitals have to control the inflow of patients and everything. So they kept pushing. 37th week, again, same results. But I know my body. I'm like, this baby has not grown like and doubled the size or percentile. Like,
these scans, especially after the 20th week, they are so inaccurate.
yeah,
And the fact that they base all of this off of these scans that have such a high like fail rate, it's just like I've seen so many inductions for SGA, small for gestational age, or LGA, large for gestational age, where the baby's born and you're like, oh, actually, it's average. It's not. It's just like,
it's like
oh.
my daughter. She was born at 3.5 weeks. The first thing, oh, it's not actually such a big baby. She's average.
And they're all happy, like, oh, actually, it's fine that was all wrong, but like you should be happy that it was wrong. It's even better that your baby's average. It's just like, so you mean like none of this was actually necessary, but they don't ever mention it in that way.
So 37 weeks, she wanted to induce me, and I was like, no. If you want to do something, I may be okay with a membrane sweep, because I did want to go into labor, and I wanted so that was okay. Mechanical inductions up until this point, okay. 38 weeks, she started like, we need to start the induction balloon. And then because it's a VBAC, we're not able to use certain medications. So it has to be blah, blah, blah. So we have to start off with the balloon. And I was like, okay. But I kind of skipped the hospital for a couple of days. I wasn't picking them up. I was like, I'm so busy right now. I'm at work. And I ended up like 38 weeks. 38 weeks and 1 day, I went to the hospital, put the balloon. And I immediately started feeling contractions, but I didn't want to tell anyone, because I didn't want people to push me to be admitted. And also because I just wanted to like level and lower the expectations. Even like, I didn't even share with like Bruno, like how painful they were up until a certain point. And when the balloon fell, I was also already at like 5 or 6 centimeters dilated. Like it was, or I think 5 centimeters. So I went into the hospital, they checked me out, blah, blah, blah. And then they wanted to move very fast. Like, okay, now that the balloon fell, we're going to do oxytocin. And I said, well, let's wait for a little bit. So I waited a little bit. Eventually, again, if you're in a hospital setting, you kind of like lose half of the power just for being there, because it's protocol, procedure. So I tried to push the decisions as much as I could, and as much as I could voice them. The birth plan, at least this time, like I was able to take the birth plan. The nurse went over with me, and a very curious story. The nurse was pregnant, and in my birth plan, it was talking about like the birthing position. And she's like, well, I will have to check with the head nurse if you're able to deliver in another position other than lying down.
If we're going to allow you to position your body however you want to.
By now, everyone that's watching kind of like already knows me. So I was like, I'm sorry, you may talk to whoever you want, but I'm giving birth to this baby however I want.
There's no question mark at the end of that. Like, I'm telling you that this is what I'm going to do.
I'm like, you're able to weigh in if you want, and you want to be there, you can. You don't want to support, then that's fine. And this time I was able to connect with another doula. So I had my own doula, and my husband was much more prepared. He did all like courses with me, which was also a big thing. I think like it was a little traumatic, because for the couple, the first time that I went through like like my first birthing experience, you, and this is hard to say, but sometimes like we're looking for someone to blame, and unconsciously, if things go south, if things are not the way that you expected them to be, it may have an impact even in your relationship, because I felt very resentful towards my husband. Like, how come you did not protect me? How come you signed that document? And only like 2 years later, we were able to have a conversation, a honest conversation about it, in which he told me, I was scared. Although you had told me that this is what you wanted, like, I never understood how important and big this was for you. So I was scared. So I went with the information that I had on hand. Like, it's, if you told me like, no, like, oh, if like I only have a C-section if I'm dying, and in my head it was like, I thought that was pretty clear. So ladies and birthing people, communicate with your partners, and communicate very clearly, not like let people think. I'm not saying that it's, I don't want it to sound wrong. Like, I'm not placing the responsibility on the birthing person. I'm just saying that it's important to voice your wishes in a very clear way, instead of just expecting that your partners will kind of like read between the lines and understand the importance level of things for you. Of course,
Are also going to be pressure. So if they're not super grounded on what you truly want, they will be easily swayed because they're going to be under pressure. They're going to be scared, and they just want you to be saved. You and your baby.
That is, I understand that is a little shitty, because like the birthing person already has like so many responsibilities, and it feels like, okay, we're adding some more weight to like their shoulders. But at the end of the day, like, we're our own only advocates. So it's more in the sense of like protecting ourselves as having like more on our to-do and mental load list. But when I put the balloon, then tried to push, but eventually it put me on oxytocin. At least I was able to say,
which increases your chances of a uterine rupture, especially after having had a C-section. So you already have that scar, so you have a weaker area that's more susceptible to be.
Which is a little bit of what they use. It's like, we need it, but then you also have the risks. So if we tell you that we're at the limits, then you have to comply and understand and accept. So it's like, I didn't want it, so I pushed, and again, from the moment that I put the balloon until my daughter was born, it was 51 hours. Wow. So I put the balloon, I was like feeling the contractions. It was like they were regular, but they were not as strong. But when I went into the hospital, I was like pretty much like in active labor, and that was more than, I think, 27 hours. So when I got to 7 centimeters, they broke the water. And when they broke the water, which I also did not want them to do, but I didn't really have much of a choice. In my head, I kept thinking, relax, you have your doula. Like, I have beautiful pictures of this moment. And I remember, like, I lived the experience to the best of my ability to have control and power over my decisions. So it cured me a little bit, although the outcome wasn't what I wanted. But I did everything I wanted to. I danced, I put music, I've decorated the room, I put lights, I put pictures, I drew with my son, and we colored together, so I had the drawings there. So it was a beautiful experience. The doula was there, I had massages, my partner was very active, and so he learned how to use like the rebozo, which is like something that the doulas use. So everything was great, but we got up into a point. I was in the bathroom peeing, and I immediately felt this urge to push. And by that time, I already knew, like, second time around, it was like, okay, I know that I don't want to poop. I want to push. So I told her, and I looked at her, and I'm like, I need to push. She's like, follow your body. And here's an interesting thing. There are multiple studies about early urge to push. And in my case, like, because people are very used to movies, and people are very used to what we see on screen, and like the access that they have to birth. One, that they are going to dilate very quickly. Second, that it's going to be that like very linear experience, and and guided pushes. We only see guided pushes on screen. So people don't even understand what urge to push is.
Most people have epidurals, they don't even feel the urge, right?
Exactly. And here, like the amount of epidural use for a bunch of reasons, because they don't
Yeah.
understand the risks involved. And I'm not saying it's a wrong thing. It can be like a pain relief measure. I just feel like people, like women, families should have the knowledge and make an informed decision. What's the
Exactly.
risk?
Exactly.
What does that mean for you and the baby? Can this affect the baby heart rate?
Mm-hmm.
Can this slow progression if you're already like not progressing fast enough, which is not a thing,
Yeah.
but
Yeah.
they can use it as an argument. So I did not want the epidural. But I felt the urge to push. The first thing the nurse told me, because I was at about 7 or 8 centimeters dilated, she's like, don't do it. Don't do it because you're going to, your cervix is going to be swollen. And I was like, how do I hold back? Just breathe. And she was like super sweet. She held my hand and she kept telling me, breathe, you can do this. And I'm like trying to stop an urge to push, which is like from the bottom of your soul. And for 6 hours, I did it up until a point where they kept on coming back and checking. And it's like, oh, it's not progressing. The baby's still too high and this and that. And like, that's when the chaos started a little bit because the baby was high. They couldn't change the position. At some point, the doctor came in and like did the cervix exam and said, well, if I stretch my fingers, I can say you're 10 centimeters dilated. However, the baby's not very well positioned. And in my head, I was already like way past the transition states. Like I was pushing already. In my head, it was like, can't you like just like, I don't know, forceps, vacuum, like whatever the hell, like do like a maneuver, like. And at that point, up until you do the full trial of labor, you don't know if you have like a disproportion, like cephalopelvic disproportion. You don't know if it's a dystocia. You don't know. And then all the things come into your mind. Oh, it can be a shoulder dystocia because even though like my blood sugars are under control, maybe I'm to blame that the baby is like a little bigger. And then all they have to back up is the freaking ultrasound in which the baby was showing as big. So that's when the conversation started. Well, you are fine, the baby's fine, we'll keep on going until you want. And then they start putting the decision on you, but in a very subtle way saying, at any time an emergency could happen, Mariana. So the first thing I did, and actually the last thing I did was, how can I stop the urge to push? Epidural. So it was my first like lost battle. I was like, fuck, I don't want to, but if that's the only way, okay, let's try. So I had the epidural. Thankfully, I was able to talk to the doctor, and he was much kinder than the first anesthesiologist in my first birth. He gave me a super low dosage, so I was still able to move my legs.
Oh.
And I think it was like out of strength and like willingness, because I said, I will not accept not moving these legs. So I went on all fours, and everyone was like, how is this person with an epidural on all fours? And I'm like, I don't know, but I am. And that's it. And also because I had the doula, my partner, so I had a lot of assistance from them, and we kept on doing things hidden. Like she was like trying to hold the Wi-Fi baby monitor, like the because they wanted to hook me up to a machine. I was like, no, I want the Wi-Fi one. So I was able to get that to have more movement. But it was very funny because when the nurse exited the room, we kept on trying like babies, like spinning babies and this and that, and on all fours and peanut ball and this. So I gave my all, I gave my all. But again, we don't know things until we go through them. So after my experience, I researched, and I'll touch that a little later, about the early urge to push and the conduct that are suggested. There's multiple studies, but my feeling is, at that time, to make a decision, I depended on the doctor and the nurses. And it felt like the only people willing to help me and try to find like ways out or like workarounds, approaches, were my husband and my nurse, my doula. Like, what can we do? What can we do? What can we do? And at the end of the day, like all I had was a nurse telling me to stop pushing, a doctor saying, if you want, you can try epidural. But I feel like, I remember this phrase, I have to be realistic with you. Right now, I see your chances of a vaginal delivery like decreasing. Like when you came, it was like 100%. Now it's like 2%. How encouraging is
So
that?
encouraging.
And how do you come to this number in your
Yeah.
head? It's like, oh, my experience, like my previous, like.
Yeah.
But at this time, after like 51 hours of induction, I was exhausted. What I wanted for me was the ability to experience the birth as I wanted. And up until that point, I was able to like have free movement, to eat, to listen to my music, to be with my partner, to like, so I can say I was like satisfied. So that part cured me a little bit. But I also feel like there's a piece missing, that I feel like I should have had access to more prepared professionals that are more up to date with approaches. And after I ended up going for a C-section, and I did a really nice speech that made everyone cry, which was, I don't, that's not the outcome I want. But with the variables I have in my hands right now, with the context, the information, I choose to go for a second C-section because I have a baby at home that I need to get back to. And also, I don't want to get to a point in which this is going to become an emergency. So it's a choice, and it's an impossible choice. You either keep on going and you have the risk, or you decide to take a step back and you're letting go of something that's important to you, but you know that you're making the decision on your own. So that part was good. I made the decision. No one directly pressured me into it, but it's very subtle. It's like a very fine line. Like no one pressured me. She kept on saying, we'll keep going until you want. But at the same time, there's the comments like, you don't want to go to become an emergency. I see like a 2% chance. You're not progressing. Like, if I stretch my fingers, you're at 10 centimeters, but the baby's too high and there's not really a lot we can do at this point. So I felt like you were supporting me, but you're also not giving me a lot of options. And so I decided to go for the second C-section. And to me, the hurtful parts, like after I delivered, I cried more than my first time, because even though it was a curative experience, I was cured to a great extent. We don't know if we're going to have more kids. It's something that we may, but it's just, for now, it's a no. And it felt like a super big grief. Like, one, because I know a VBA2C is even harder, in a sense of like harder to get support. Like medically saying there's not really a lot of differences, but like it's harder to get support. It's harder to find professionals that are willing to do this. And if I face the same challenges, I am more discouraged now to find the right professionals that will know the approach and the conduct and the suggestions of what to do. Like, for example, I've found like studies saying, there's a really nice one that I can share later in the comments when we publish this, of there's from the University of British Columbia, early pushing urge before full dilation, a scoping review, which mentions like some approaches for this. Like magnesium is one way of like using. There's certain narcotics that you can use to like stop the early pushes. Some of the research is more related to preterm labor, but in this case, it wasn't a preterm labor, but there are newer studies that mention that when a patient is not fully dilated and is feeling the urge to push, there are certain conducts that can be tried and tested that are not harmful to kind of like help with the urge to push, to not cause the cervix edema, which also there are new studies saying that the cervix edema is not necessarily like something that's going to happen 100%. And the newer studies suggest that letting the woman push is actually better than telling her not to, which is even, it's suppressed, like, which is like impossible at the end of the day. Older studies will say what they suggested, epidural. But the epidural only kind of like takes the feeling away because the urge to push is there. So it's not like it will stop. So there's like newer studies suggesting different medical conducts that would reverse a little bit to give time, which is all we need. Time, respect, and being like embraced in this moment so that we can labor in peace in our own time. and really only have interventions when medically justified. And I feel like we intervene when that's not the case, just purely for time, which is a bigger problem than just doctors and nurses. It's a problem of like broken healthcare systems that cannot accommodate the amount of people that need it. So we could be here an entire day discussing it. But in my case, you know, to wrap it up, like it was a curative experience up until this point, but I also feel like, again, robbed of having professionals that could perhaps help me with positioning, with certain things that you only really see in specific case scenarios of professionals that have dedicated their lives to giving women or birthing people this the experience that they want and the journey, the labor journey that they want. But those are like exceptions, like out of the curve exceptions that will go and study and understand and be up to date and try and defy the common sense to try things. And in my case, like I felt like this grief for a very long time. Like I cried, and I even felt like the pain from the scar, and from like, even though she like used the same scar, like you barely can see the line. I had a lot of support from like other professionals, like pelvic physiotherapists, like laser sections. I don't have like any numbness in the area. Like physically speaking, everything is perfect.
Yeah.
But when I talk about it mentally, it's like for a very long time, it felt like I will never, ever, even though it went all the way to urge to push, and like, which was just like popping the baby out, like the one thing missing, but like that one thing missing that I felt like I will never have this if I don't have another baby. And if I decide to have another baby, I don't know, which also impacts me. See, the first birth impacting my decision on having a third child or not, a fourth child or not. Like, what if I go through this again and I'm unable, or I end up not having a VBA2C? How is that going to feel if this was so traumatizing? Am I going to feel destroyed? Is this going to impact my kids? So
it's never looked at, right?
It's not.
All of those layers. There's so many layers. It's not just, oh, surgery was success, you're stitched up, you're good to go. Like, that's not even the big picture. There's so much there, so much to uncover, and those things are never taken into consideration. Or the fact that if you want to have 5 kids, it's just like, first time they don't even like bring it up, and then like, oh well, I probably should just have another C-section. It's like, oh wait, 4 kids, oh it's just risky now. Oh, but a VBAC is also risky. And the support, like, oftentimes, and I saw this in the hospital, and I know some hospitals are better than others, but a lot of the time, unfortunately, all the women are just treated like the textbook. Come, we're going to do exactly this, and if you don't fit into the timelines we have, then oh shit, we're going to have to do a C-section. And if hospitals just hired support for these women, like doulas, doesn't have to be like a medically trained. Most of the time, women just need support. And if they had that support in the hospital, that would help, like, natural births. Like, the numbers would rise so much more, and it would diminish the rate of C-sections, which is concerning.
All the complications for women and babies.
And then not making women push on their backs. There's so many things that's just like, can we just listen to the women, please? Like, why and this is a lot of time women doctors or women nurses who are pushing this without taking a moment to step back and be like, am I okay with this? Does this feel good inside of me, how I am making this woman labor and I'm not supporting her in the way that I know is going to benefit her and increase her chances of having a beautiful physiological natural birth? Or am I just following the rules and not thinking twice about it?
And not questioning. I think that people don't question. I forgot to mention, but the pregnant nurse that was in the room with us, and she told me at first, I'm going to have to check with the nurse if you're allowed. I was like, I flipped out. she came back and she said, I'm so sorry. And that was one of the saddest thing I've ever heard in my life. I'm so sorry. I actually talked to the head nurse and she said, you can. It's just I've been here for 8 years and I have never seen anyone giving like birth in a different position.
Yeah. Yeah.
And I was like,
That's
you're pregnant. You know you can labor and like give birth in whichever position you want, right?
Yeah.
And at that time, it was like, it wasn't even about me. I was like, she's pregnant. She doesn't know her
Yeah.
options. She is
Yeah.
a healthcare professional and she does not know that
Yeah.
whatever she saw throughout the last 8 years is actually something that's not very beneficial for her body. Like if she
Yeah.
wants to do it, by all means, you can do whatever
Yeah.
you want. But it's just like
Exactly.
informed decisions and information, which is why I became a doula and perinatal educator. So when my daughter was 6 months, I signed up for Doula Canada, and I have yet to finalize a few things for my course as a doula and perinatal educator, but I've already assisted a few births and done some, but all because I have my career and everything, but I do this only like free of charge, like pro bono for families that don't have support or that are like no, they don't have the privileges to have the same type of like education and get resources to understand and learn more about birth, knowing very well the limits, because I'm not a nurse, I'm not a doctor. So just to give support and like resources for them to find information and ask the right questions. And I've also created a VBAC group. But about the doula thing, what I did not mention is, as a doula, I wish like this, every time that I worked as a doula, I come home with like my eyes like shining and this is like what I love. But at the same time, I was discussing this in a doula group. It's like my calling, but I could never commit to it 100%, not because of like how much I would make in this career or lack of like, it's simply, and it was hard to admit that for myself because of my own experiences and my own faith in the system. I am not ready, although my experiences were taken care of and I'm like fine with them now. I am not yet ready 100% to dive back into a world that will bring back a lot of memories that I worked hard to not suppress, but like to deal with. So I could never fully commit to the doula career. So I've been pushing to finish the certification and I realized it took me a while to speak out loud with myself and admit that it's still hurtful. And that first experience still like has a toll on me. And I like the reason why I cannot commit to this like 100%, although I love helping people, like I could make this a career and I know I could be successful. It's just, it would be extremely hurtful and painful for me to experience that, like, and I don't know how I would react because the births that I gave, that I assisted were like home deliveries. So I don't know in a hospital setting if that would be triggering. So to be honest, like, and it took me a while to understand that. Like, I don't
Well,
know.
it is. It is triggering. And while I was working in the hospital, it was triggering to me even before I gave birth. Just I was questioning things and I was like, a lot of this just doesn't feel right. Like this is bothering me. Like this shouldn't be this way. And I understand, like, and I say this all the time, I'm so grateful that we have medicine and we have these interventions when they're needed. I'm not saying that every woman should be having a physiological home birth. That's not what I'm saying.
No.
But the fact that what the reality is, the way birth is dealt with in the hospital is it's messed up in a lot of ways and it's uncomfortable. And this is why I'm trying to bring awareness into this, especially for healthcare professionals. Maybe some nurses that I was working with are listening. There are so many women who are now choosing to birth outside of the system without midwives because a lot of time they're considered high risk like you and they're not able to have a midwife. So it's either in the hospital and they go through all of that or they birth alone without support. And also the reason why so many women or doulas start off supporting women in the hospital and at home. And then they start to see a difference with the home birth, with midwives versus OB. Like, okay, this seems nicer. Like, I like this more. But then they start to see that so many midwives are so bound by their license and restrictions that a lot of the time they're transferring for these unnecessary reasons, and they're still ending up in C-sections. And they're starting to choose to be like, I can't support women in the hospital anymore. I'm going to support women who are choosing to birth outside of the system, because that's the only way I can stomach what I'm seeing and I can truly be there for them, and I don't have to watch them get abused. Because a lot of the time doulas have no power in the hospital. And even if they are trying to advocate, like, they're just like, yeah, you're not a medical professional, get out of here. Like, and they're just like, ah, I'm just holding their hand while they're getting abused. And a lot of women can only do that for so long until they're just like, this is fucked up and I
Yeah.
can't do this anymore. So that's a whole other topic. I'm getting a
Yeah.
doula on, and we're going to be talking a lot about these
Awesome.
topics, but it's just stuff to think about. So,
Yeah.
yeah.
And the last thing I have to say is just to invite everyone that would like to get more knowledge about VBACs. I created a VBAC support group. I can share like
Beautiful.
the
Yes.
QR code for you later,
Yeah.
in which we have 20 members now,
Amazing.
and all of the women that are in the group and that experienced a second, third, fourth pregnancy, and they were looking for a VBAC. So the vast majority successfully had their VBACs with
Yeah.
positive feedback of how the
That's
group
awesome.
impacted and
That's so
how
good.
the resources shared their helped. And
Yeah.
the couple of people who did not have a VBAC, myself included, they had a positive birthing experience because they made informed decisions
Mm-hmm.
and they felt in control of, like, they made the decisions on their own. Like, they
Yeah.
understood why. And even like if the outcome, the desired outcome was not that, they felt like they were getting what they needed from that experience, and they had the power to say yes
So
or no.
important. Yeah.
So 20 women being impacted in a short period, like, and
Wow.
some of them having like life-changing experiences and being able to have, like, I have people who had completely natural VBACs, home
Wow.
delivery,
Yeah.
vaginal delivery, and going through
Beautiful.
oh, I forgot the name of the condition. Like, one of them had like a specific condition that it was so challenging to get her VBAC that it wasn't preeclampsia, it was something else. I cannot remember now, but she had like a specific condition that she had to get treatment, like late stages, but she had her VBAC,
Wow.
and
So
everyone like
good.
just transformed and like lives
Yeah.
touched. And I'm sure that this will have an effect and impact on their babies and
For sure.
their journeys.
100%. Yeah. 100%. That's beautiful. So powerful. We will link all of that below for other women to be able to access. So thank you so much for sharing your beautiful stories. This is gonna have to be part one and part two,
Yes.
but that's okay because such a good episode, so rich, so much information, and thank you for sharing your vulnerability and really talking about these painful, you know, times in your life, because I think a lot of women do experience this, and a lot of time we're made to just think it's normal, it's how it is. Don't cry about it. So I think it's important to be like, it's okay. We can complain, we can cry about it. It shouldn't be this way. But just before we close off, just want to ask you, is there an advice, something you can sum up that you can share for moms who are pregnant or thinking about becoming pregnant, something you wish you had been told?
Yes, well, first, thank you so much for having me
My
and
pleasure.
for listening, whoever is still with us. But my advice, I have two advices. One, for
Hmm.
every mom or mom to be kind to yourselves. This is a journey and a long one. And although we don't have control over everything, you just have to be kind. It's a bridge that you cross that you've never done before, no matter how many kids you have. It's the first time you're the mom of that specific kid. And you're allowed to consider that like people experience miscarriages and they have different ways of processing it. I still consider my first miscarriage as a child of my own. And if you like to count that as a child, please do. If you don't, that's okay as well. It's your way of processing, and no one should judge whichever choice that family, that woman has. And the second advice is you are allowed to question. You are allowed to question and to feel like you should not be silenced or you are not satisfied with the answers. You're allowed to question until you get the answers, and the proper ones, the way that you want, with explanations. That's what the healthcare system is there for. That's what you contribute for. That's where you're entitled to, not because you're paying taxes for it, but because you're a human being and that's your human right. And it's not a favor. If you ask questions, if you have any decisions that you want boards to make, you are allowed for those decisions to be informed ones, and for you to have the complete knowledge and know what you're walking into, and request the evidence. Where are you getting this from? Why did you come to this conclusion? And question. You're not annoying because of that. You're a patient who deserves respect, and a patient who deserves empathy and support at all times. So please do, and be kind to yourselves.
Yes, beautiful. Great advice. Thank you so much. It was a pleasure. I'm really glad we did this. Thank you.
Thank you.
Bye. Until
Bye.
next time.
Thank you so much for tuning in to Birth Unboxed. If you've enjoyed today's conversation and want to hear more, please consider subscribing to the podcast so you never miss an episode, and leaving a review. I'd love to hear your thoughts or even your own birth stories, so feel free to connect with me via Instagram at thebirthunboxed.podcast or through my website linked in the show notes. Until next time, friends.